Hi everybody, this is Kelly Ritchie, one of the registered dietitians here at Avita, Ontario. Today we're going to be going through Class 2, which has information on protein and the vitamin and mineral supplements that are required after bariatric surgery. So talking about the vitamins and minerals first here, why is supplementation, or why do you have to take these supplements after bariatric surgery? For the first couple of days to the first couple of months even, our patients report a lot of nausea, vomiting, and sometimes just a lack of appetite. So it is very challenging to get all of the food in that you would need in order to have a well-balanced diet when it comes to your micronutrients or your vitamins and your minerals. Long term, even after the nausea, vomiting, and lack of appetite tends to start to fade away, you will still have some malabsorption, more so with our bypass patients than our sleeve patients, but malabsorption of some of those micronutrients for sure. A lot of it has to do with shrinking that stomach size and reducing the amount of stomach acid that is produced. And once again, some people have intolerance issues. They might start eliminating foods or food groups that don't sit well with them. For example, maybe they would eliminate dairy if it's causing an intolerance for them. So that limits the amount of, let's say, calcium or vitamin D that they might be intaking. And so once again, those supplements just kind of help cover our bases and help give you a more fulfilled, healthy diet. So even pre-op, America as a whole does a poor job of getting all of the vitamins and minerals that we need, even with our full-size stomachs, even with our eating patterns that we currently have. Most men and women fail to get majority of the RDA of the different one or more micronutrients. Only 3% recommend the number of servings from the 5 food groups, so that variety of foods gives you different vitamins and minerals. And the majority consume 100% of the RDA for the following, but there are some on that list that are not covered. So we want to make sure that we're, like I said, covering all of our bases here. So when it comes to pre-op vitamin and mineral requirements, so before surgery, there are some worries we have with vitamins and minerals. So patients will complete lab work prior to surgery. Usually this is completed within 2 weeks of your initial bariatric appointment. If it's later than that, that's okay. The biggest concern is just making sure we get the lab work back with enough time that we can make sure to correct those nutritional deficiencies if any are showing in your lab work. Once you get your lab work done, the bariatric clinic will call you and order supplements as needed for individuals who have these nutritional deficiencies. Lab work will be taken at your pre-admission testing then to confirm the success of correcting that deficiency or if there's more work that we need to do. As for your pre-op journey, everybody, even if your iron levels are normal, is going to be required to take an iron supplement. That iron supplement is hematogen. It's 1 capsule per day, and it's got 66 milligrams of elemental iron in it. You'll start taking this 2 weeks prior to your surgery, and the bariatric clinic will write you a prescription for this. This is to help prevent iron deficiency anemia after bariatric surgery, which is the most common deficiency that we see. This supplement is supposed to be a form of gentle iron, so it is a nice way to see how iron may make your GI tract feel after surgery, as iron, we'll learn, is one of the post-op minerals required with this program. So the required supplements for our program that are based off of the ASMBS guidelines, the American Society of Metabolic and Bariatric Surgery, are going to be the multivitamin, B12, iron, calcium citrate, and vitamin D. We have the amounts listed there, so when you go shopping at any point, whether that's pre-op or post-op, whether that's online or in person, you can take this with you or take a picture with you so you can compare the label to the certain brand or product that you are looking at compared to what we are recommending. So starting off with what types of supplements you can use a lot of the different oral routes, or the ones that are by mouth. So you can do pills or capsules. If some of those seem a little large, you could always use a pill cutter or crush them as needed. You can do chewables. I call these the powdered chews. These are going to be kind of like a Smartie or a Sweet Tart in the sense that they are powdery. Most of your children's vitamins are kind of like this, like a typical Flintstone would be an example of a chewable. A soft chew, this is going to be more gummy, kind of in between the two. It's not necessarily a gummy because that's further down on the list, but the soft chew has a texture similar to, let's say, a Starburst. So it's definitely not powdery, but it's not as gummy as the gummies are. And beyond gummies, you are allowed to do liquid. With all types of these, you're going to make sure with the chewable soft chews gummies, it's that you chew them up really, really well, break them apart so that way they don't get stuck anywhere else. We don't recommend doing any of the vitamin patches at this time. We just do not have enough research to support them. So right now we're trying to encourage patients to do the oral routes if they can tolerate them. If we need to come up with a backup plan, we would want to discuss that not only with the dietitian, but Dr. Karis or Deanna or the surgeon or the nurse practitioner. With your multivitamin, you're required or asked to take 2 times the daily value, so 200% of the daily value. Your typical multi has 100%, so you could just double one of those, and that's an example that's listed here. 2 times the regular adult vitamins, such as a Centrum, women's or men's 1 a day. You can also do children's. You just have to double those as well. So Flintstones do work here. If you prefer the taste and texture of those, you're welcome to use those instead. Just realize that the women's 1 a day, the Flintstone, they are going to cover your multivitamin. There is not a guarantee that they are going to cover your B12, vitamin D, iron, or any of the other vitamins and minerals that are listed on that required list. So be careful. Make sure you read your labels. A lot of the times with multivitamins, they'll say multivitamin with iron. You just once again have to double check how much iron is it giving you. Is it giving you the proper amounts? With a prenatal, that you only have to do 1 a day if you decide to go that route. They have more than the daily value in them already, so they're good to go. And same with the bariatric brand. They are made for bariatric patients, so they know you need 2 times the daily value, so they usually will put 2 times the daily value in their multivitamins. Also, what's nice about the bariatric brands, in order to help cut down on how many vitamins and minerals you have to take after surgery, they will usually make combination multivitamins, which we will cover a little bit later. So moving on to B12 here. B12 is known to help with our body's nerve and blood cell health. It does help make DNA, which is the genetic material found in all of your cells, and that's how your body directs how it metabolizes and processes, what it builds, what it breaks down. Your DNA also allows you to encode or to code for the way that we look. So that helps determine your eye color and helps allow for those proteins to make a specific eye color, or reflect a specific color. So very interesting there. When it comes to B12, if you don't get enough in the diet, your number one thing that you probably would develop would be an anemia, type of anemia called megaplastic anemia, which makes you feel tired and weak. A lot of the reason why we don't get enough B12 after bariatric surgery or aren't able to absorb it quite that well is because we have less stomach acid, and we also have less intrinsic factor, which are both made by the stomach, and therefore without those 2 factors or 2 items, B12 becomes increasingly harder to absorb. So that leads to the malabsorption of it. So that B12 supplement helps cover our bases there once again. Usually you find B12 in animal sources. It can be added to plant foods. A lot of fortified foods like breakfast cereals readily have B12 in them. However, they are not at the amounts that you need typically, number 1. And number 2, if we're not absorbing all the B12 from the diet, we still need that supplement. So how much to supplement? You need 1,000 micrograms per day, or mcgs. This could be found as a part of a multivitamin. That would be typically maybe in a bariatric multivitamin that it would carry all 1,000. So once again, just check your multivitamin, see how much you're getting, and just be careful. Just remember with the women's 1 a day or the general multivitamin, or even with the children's multivitamin, is that if you're taking 2, then you want to double the amount of the vitamins and minerals that are listed in it. If you're taking it separate from your multivitamin, you can take it at the same time. So you can take these both in the morning together with no issues, no concerns there. Or we do have the option of doing a monthly shot. I haven't heard very many patients doing these currently, but that is an option. So you wouldn't have to take a B12 every day. You could go in for a monthly shot and be good to go. So the next one on our list to talk about is iron. This is one of our minerals. It's an essential element for blood production. About 70% of your iron is found in your red blood cells. It's a part of a structure called hemoglobin, and if it's a muscle cell rather than a red blood cell, that is called myoglobin. They do very similar functions, and iron is needed in both. The other 30% is used as storage forms or is stored. This could be ferritin as an example of a storage form of iron. But what hemoglobin hemoglobin allows you to do is allows you to transfer oxygen. So it allows the oxygen to move from the lungs to the tissues, and iron must be altered by the stomach in most cases in order to be easier to absorb. We could get into a chemistry lesson there. Basically, your stomach acid reduces or puts it into a lower electronic state. So it just makes it easier, makes it prepped and ready to go to get absorbed if we don't want to get too complicated there. So there are plant and animal sources of iron. Most animal sources will have more iron than plant sources. I'm sure there are always exceptions to the rule, but that's typically what you're going to see. Usually animal sources are a little bit easier to absorb iron from as well. Plant sources need more stomach acid typically to get it out or get it into the proper electronic state. So when it comes to iron supplementations, they usually recommend 45 to 60 milligrams a day. This could be a part of a multivitamin, especially if it's a Bariatric brand combination multivitamin, or if you find a good multivitamin with iron that has enough that gets that 45 to 60 in. Otherwise, you can take it separate, but at the same time as that multivitamin, so no interactions there. You can take them together, no problem. You do not want to take your iron with your calcium. I cannot say this enough. Do not take iron with calcium. If your multivitamin has some iron, do not take your calcium with that either. Calcium and iron compete for absorption. They use the same absorption sites in the gut. So if iron is sitting on the absorption site, then calcium is just going to keep moving through and not get absorbed, and vice versa. So it's not harmful. It's not going to necessarily hurt you, but it will make it challenging or impossible to get enough iron and calcium if you take your supplements at the same time. Vitamin C can actually increase the absorption of iron. It's because it's found in acidic things like oranges, tomatoes, or other citrusy products. Some of your iron supplements already have vitamin C added. They might say plus vitamin C. They might say plus C. I think that's what's on the Celebrate Iron. It says plus C on it. So that just means it has some vitamin C in there to help with the absorption. And iron is notorious for constipation. So if you are noticing bowel movement changes after bariatric surgery in the constipation realm, please talk to your dietitian. Please talk to your surgeon or talking to your CNP or nurse practitioner. There's some things that we can do from a diet perspective. What I would recommend as a dietitian is you make sure you're drinking plenty of fluids, stay hydrated, and try to increase those fiber foods as you are able to. Those are usually going to come in around the soft, maybe even into the regular food textures is where you're really going to get a lot of your fiber. So just realize that for the first couple of weeks, it's challenging to get fiber in unless it's added maybe with like a fiber supplement, which is absolutely an option. I know that our surgeon here, Dr. Kerr, she will usually prescribe things like probiotics to help keep things moving. She might even ask you to drink some cranberry juice. She can also prescribe stool softeners if needed. So there are options. You just got to be communicative. And I know not everybody likes to talk about bowel movements or stools, but this is a very safe place. You just had GI surgery. We know that things are likely going to change. So the next thing that we have to talk about is calcium. So what does calcium do? Most of your calcium is found in your bones and your teeth, helps keep them nice and strong. So 99% is stored there. The last 1% is kind of hanging out in your bloodstream. And even though the majority of it is in your bones and teeth, the more important things that calcium does is in the blood. So it allows for cell signaling, it allows for blood clotting, it allows for muscle contraction, and last but not least, nerve function as well. So muscle contraction, I think a lot of us think of our voluntary muscles. Like, I want to go move my arm or flex my arm. I can do that. Calcium is needed to do that, but it's also needed to, for your cardiac muscles, your heart muscles, the ones that we might not think about utilizing. In order for those to contract, it moves or shifts calcium in and out of the bloodstream. So with that in mind, since I said those are more important, your body tries to keep a consistent amount of calcium in the blood. So your body will actually stimulate a production of a hormone called parathyroid hormone, or PTH, that will actually pull the calcium stored in the bones, making them brittle, making them weak, in order to allow for the functions that are played by the 1% of calcium that's typically found in your blood. So just realize, even if your calcium comes back normal in a lab, that does not mean that you're getting enough calcium in your diet. Sources of calcium include dairy products. That's number one probably here in the States of how people get their calcium in, but there are some plant sources, a lot of green leafy vegetables like spinach and kale on there, collard greens even. Seafood's a really nice one too, especially if you have the bone packed in the case of like sardines or something like that. And a lot of fortified breakfast foods, orange juices, oatmeals, and breakfast cereals will have some calcium in them too. So with calcium supplements, the reason we want to supplement this after bariatric surgery is that some patients, like I said, might develop a lactose intolerance. They're going to need to get their calcium in another format. Also with calcium, you need to spread it out throughout the day. You can't intake all of your calcium at one time. And in order to meet 12 to 1500 milligrams a day, you would have to eat probably 4 to 5 servings of dairy to get that all in. So, because majority of them will have about 300 milligrams or so of calcium. So it's challenging because you guys usually don't have enough space physically after bariatric surgery to do that. And like I said, that's a lot of food just from one food group. So then you would be lacking in maybe the protein, or not the protein department, but maybe lacking in a different micronutrient or different food group. So with this, we recommend patients get between 1,200 to 1,500 milligrams a day of calcium, including food. So with the supplement piece, usually that's 1,000 to 1,200 that we would recommend at least coming from a supplement. Since your body can't absorb all of the calcium at once, you have to spread it out. No more than 500 to 600 milligrams at a time gets absorbed. So that usually means taking calcium at least twice a day, if not 3 times a day, depending upon how much calcium you can get through your food. Be sure you purchase the right type of calcium. Calcium citrate is the best one, the one there in red. It's absorbed better without acid or stomach acid, so you can absorb it more so than the calcium carbonate, which needs an acidic environment to be absorbed. And once again, do not take your calcium with your iron or your multi, especially if that multi has some iron in it. The two compete for absorption. You have to space at least 2 hours apart. I would even say that your calcium supplements need to be at least 2 hours apart as well. And last but not least here, vitamin D. Vitamin D helps maintain good bone health. It actually increases absorption of calcium, which is down there at the bottom, which helps with that as well. Helps improve immune system, can improve insulin release. We don't have a lot of research to support that it can cure or really help with diabetes all too much, but it does help a little bit with that insulin. And last but not least, with mood elevation, that seasonal depression that a lot of us struggle with, especially the further you are away from the equator, those sunnier states or areas. So where do you find vitamin D? With your food items, fortified dairy products. We add that once again to help get the calcium there. Fatty fishes, eggs, fortified cereals, and this is the sunshine vitamin. We can make it by converting sunlight, or using sunlight, to convert cholesterol into vitamin D. You do need good sunlight exposure, and you need at least 15 minutes of direct sunlight exposure, and that would be every day. And in Ohio, you cannot guarantee that you're going to get that every day due to the cloud coverage or even the chill in the air and things like that. We would be covered up, and so if you have a hoodie on and sunglasses on and pants on, you really aren't showing necessarily enough skin to convert enough cholesterol to vitamin D. So how much supplements do you need when it comes to vitamin D? You need 3,000 IUs per day. International units is what IU stands for. That's typically what you're going to see vitamin D measured in. You can find this as a part of a multivitamin, especially if it's one of these combination multivitamins I've been talking about, or you can take it separate. If you are taking it separate, just meaning every vitamin you take is coming from a different container or a different bottle, I would recommend taking it with one of your calcium supplements, especially if they don't already have vitamin D added. Once again, it will just help with that absorption of the calcium. So we wanted to go ahead and put together a couple of pathways or examples of how you can spread them out throughout the day, because you can't take some of them with each other. You have to spread certain ones out. And so we wanted to give some examples here. So we have the multivitamin, B12, iron at breakfast, the lunchtime having a calcium, and then dinner, this individual is taking a calcium and their vitamin D. So this is assuming that you're taking all of your vitamins and minerals separate. Like I was saying, they're all coming from separate bottles or containers. None of them are hidden or within another vitamin or mineral. So this allows you can space them into meal times if that helps you remember them. If you're somebody who doesn't want to have to take their vitamins or minerals to work with them, then as long as the vitamins such as iron and calcium are spaced at least 2 hours apart, and then that calcium to calcium are 2 hours apart, you could set reminders on your phone or alarms to take them prior to or once you get home from work. As long as you can have at least 6 hours basically that you can take them, that would work, because you'll take one, wait 2 hours, take one, and then wait another 2 hours. So actually that would be 4 hours. Sorry, math, right? So this is all separate. If you manage to find or are able to afford or find one that you like of a combination multivitamin, This is an example of a multi with iron. This is assuming that multivitamin with iron made by a bariatric brand has enough of your B12 and vitamin D in it as well. So that kills 4 birds with 1 stone usually. Sometimes it's 2, just depending upon the brand that you use, but you can take them at the same time, even if it's 2 pills or 2 chewables. That just leaves your calcium, so you just take your calcium twice later in the day. So whether that's with lunch, with dinner, or at least 2 hours apart from the multi in the morning and at least 2 hours apart from the other calcium. This is by far the most efficient method. This is the one I would encourage you to look into the most. The last one here is the multi with calcium. Same idea here. It has everything in it except for iron. So it's got your multi, calcium, vitamin D, and B12 covered. But since calcium can't be consumed or absorbed all at one time, you have to take this multivitamin at least at 2 different points during the day. A lot of the times it ends up being 4 tablets daily, 2 at a time. Just depends on the brand though, but that's the one I'm the most familiar with. And then since it doesn't have iron, you have to take your separate iron at least 2 hours after that last multi. So those are your options. You can buy them all separate. You can look into these bariatric brands. I would highly recommend it. We have Op Purity currently at our pharmacy. We also used to work with Celebrate, so we still usually have samples of those laying about. And we also have samples from Bariatric Vantage as well as ProCare. So if you have questions about them, we have some pamphlets and information that we can give to you, or just hop on their websites. They will give you price ranges and how many, like what day supply that would be and things like that. So in summary, these are the 5 that you need. It's the same for our bypass and our sleeve patients. So whether you have the sleeve or the bypass, we recommend the same vitamins and minerals. If you go all the way down to the bottom, all other vitamins and minerals as needed. Sorry about that. All other vitamins and minerals as needed. So if another vitamin or mineral comes back low, or if you're already taking something for another provider, we could, you would want to probably continue with those. Of course, you want to talk to your physician prior to stopping or starting vitamins and minerals, just because they can't interact with medications. So please, if you're already on something, let Dr. Karras know, surgeon, or let the CMP know, and that way they can counsel you on what to do, or like we said, talk to maybe that physician that is prescribing them already. Maybe it's a potassium because you're on a water pill or something like that. And if we find that something is deficient in your lab work, of course, Dr. Karras or Deanna, our nurse practitioner, would encourage you to start on another supplement to help cover your bases there. Maybe your folic acid comes back low. We might hop on a folate supplement or something along those lines. But labs are drawn at 6 months, 1 year, and your yearly anniversary to check for vitamin and mineral deficiencies. So at your 6-month marker, your 1-year marker, and your yearly anniversary, you already come in for appointments for those with our bariatric clinic. So at that point, they would just order those for you while you're there, and then you can get them filled at your earliest convenience. The reason we have to keep checking for deficiencies is because you have different storage forms of the different vitamins and minerals. So like I said, iron, one of those storage forms is ferritin. Usually it takes about 30 days to show deficiency in iron because you have those stores. Whereas with B12, it can take almost a year before we show deficiencies with that because of all of the storages of B12 in our body. So just realize that's why we have to keep looking at it. Also, a lot of people go on and off of their vitamins. They're trying different brands, trying different things out. So we definitely want to keep checking back in. We can't just assume things are good at 6 months and they're always going to be good from there. If you've got questions about the labs, feel free to ask a dietitian or ask the bariatric clinic. I'm sure they'd be happy to go over them with you. Like I said, the only lab that is really hard for us to track is calcium. We usually take a parathyroid hormone around along with that, so we can try to differentiate if it's normal because we're getting enough from our supplements and our vitamins, or is it normal because we are breaking down bone to keep it normal. So that wraps up the first part there with the vitamins and the minerals. The next part here is all about protein. So class 1, we talk about carbohydrates, which is one of our macros. Protein is the next macro we're going to talk about. And then class 3, we cover fats, which is our last macro. So macronutrients means that there are calories provided, just meaning it gives our body energy. They usually have other roles in the body as well. So protein is used to build and repair tissues. That could be, once again, those skeletal or voluntary tissues or muscles that we think about, but this could also be cardiac tissue. This could be also other structures in the body that are made from protein. Helps maintain energy levels, helps preserve muscle mass during weight loss. So even with a calorie deficit or energy deficit that we're hoping to achieve with weight loss, we don't want to break down muscle mass. We want to keep those nice and strong. That's where a lot of your metabolism or burning capabilities comes from, is the muscle cells. Protein can provide a sense of fullness. It makes us feel fuller longer, so it helps us feel satisfied with smaller portion sizes, and it can help prevent hair loss. It's not going to completely make it, basically, if you get your protein in that you need, that doesn't mean that you can't have hair loss, but it can help prevent it if it's occurring for you or to you. So most women need about 60 to 80 grams of protein a day. Men typically need 70 to 90 grams of protein. If you are tall for the average woman or male, then you're probably going to need more protein. If you are on the shorter side or smaller side for your gender, then you are going to want to have maybe a little bit less protein. Just realize, like we said, protein has calories, so you can overdo it. We calculate these at every initial bariatric appointment. So this is the formula that we use. IBW stands for ideal body weight, which is based off of your height. So basically the factors that make it or determine the amount of protein you need is based off of your height and your gender for the most part. If you haven't received this information, please contact us. We have it, so we can definitely give it to you. We put a food label on here just to show that if there's a food label available, you can actually see how many grams of protein is in the product. So if you have 4 ounces of this ground beef, you would get 21 grams of protein. So that's about a fourth of your day in most cases. When it comes to sources of protein, we have animal sources of protein listed here, things like meat, eggs, and dairy. Dairy, when you are talking the different types of dairy, such as low fat versus full fat, they are going to have the same amount of protein. So we still recommend the low fat as a leaner protein source, but you're not losing out on any protein by switching down to like a skim milk or a 1% milk. With eggs, there is some protein inside of that yolk, but there is some as well inside of the whites. A lot of research has been going back and forth on how many yolks is appropriate. We usually say to try to stick with 1 yolk and then do the rest egg whites from there if you're doing multiple eggs. And with meats, that could be poultry products like chicken or turkey. That could be pork products. It could be beef. It could be seafood. So if you like things like fish, whether they are those fattier fishes or even just a typical fish, that's going to have some protein in there too. There are some plant sources of protein listed there, beans and lentils. Nuts and nut butters, doesn't matter what kind of nut or nut butter that you like. It says nut spreads. I would be careful about some of the nut spreads like Nutella. Nutella is not really a protein source. It's definitely got a lot of carbohydrates and palm oil or fat in it. And then soy products, whether it's a soy meat replacement or even just a soy protein powder or a soy milk alternative for regular milk, that still will have protein in it as well. So just pointing out some different things on here. We've got portion sizes, grams of protein listed, as well as the calorie and fat content. So I think it's interesting to look through these. Peanut butter and mixed nuts should definitely stand out. They have a lot of healthy fats in them. So 48 and 56 grams in those, and about 500 to 600 calories as well. So just realize that we want to watch out for high fat protein sources, even if that fat is considered a healthy source. And we go over that more so in class 3. But these are just some more pictures. They also have the protein listed on the left there with some of those vegetarian or non-meat based protein sources. And just realize that all of these protein sources are not created equal. Even though oatmeal is over there on the right hand side, it's not a very high or dense protein source. It's about 6 grams of protein for a whole cup of oatmeal, which if you measure out your oatmeal, it's about the size of your fist, or if you've got a cup measurement at home, you could definitely look at that. But that's the same amount of protein you would find in like 1 egg or 1 ounce of turkey or chicken or beef. A lot of them will have about 7 or 8 grams of protein per ounce. So it's not very dense in protein. It's pretty filling as well, so you wouldn't be able to necessarily eat a whole lot of other foods along with oatmeal after bariatric surgery. We do have protein bars on here. We don't talk much about those in these classes. We will definitely talk more about the protein shakes and powders though. So we do have some patients that stay away from meat products or are trying to decrease their meat. You can absolutely meet your protein needs using plant-based foods. It does make it a little bit harder. You definitely do have to pay more attention, but you already need to pay attention to meet your protein goal anyway. So don't hesitate. If you want to give these a try, you're most welcome to. Just realize that these are not superfoods. I'm not saying that you need to replace all of your meats with these products, but if you are not tolerating meat very well because it's maybe too dried out or too stringy, these are always soft, these are always moist, and a lot of patients actually do enjoy the flavor for the most part. Like I said, just don't think of them as a superfood that you should go hog wild with, or that you can't have some of those other protein sources we talked about. So limiting these protein sources, once again, doesn't mean you can't ever have them again, but trying to decrease the amount of times per week, or maybe decreasing the portion sizes when you do have these foods. High fat cuts of meat like beef chuck, chicken wings, chicken thighs, especially if those bird products have the skin on, that's where a lot of the fat is just right under the skin. So before cooking, if you can remove that, that would help. Ribs, a lot of processed meats like our sausages, bacon, salami, bologna, pepperoni, and hot dogs are just have a lot in there. And then your dairy products, going for the, these are the higher fat versions of those, or even those healthy fats found in the nuts and nut butters. Just realize if it's higher in fat, it's going to be higher in calorie than the lower fat options, because fat has the most calories in it out of all of the macronutrients. And like I said, you'll get more of this when it comes to the fat class, but trying to find lower fat substitutions, or trying to, like I said, use these less frequently, but find something else that you like to use more often. So protein after bariatric surgery is very important. You have to eat it. You got to drink it. You got to get it in somehow. We want you to be meeting your protein goals ASAP, or as soon as possible. Whatever protein is not consumed through your diet or typical beverages will need to be supplemented or added. This is where the protein shakes and protein powders come into play. We prefer food sources, but at first it's really hard to get all of your protein through just your food, because the first 2 weeks is a full liquid diet, so you cannot be eating chicken breast and you cannot be eating some of those other protein foods you might be using currently. So we have to kind of rely on these powders and shakes to get us through. When you're looking at purchasing a protein shake, just be mindful they're not necessarily the same as a meal replacement. Those tend to be made for people who aren't eating well, they don't have a lot of appetite, they're losing weight, but it's unintentional. We're trying to prevent more weight loss. These would be things like regular Ensure, regular Boost, Carnation Instant Breakfast can sometimes be considered a meal replacement, as well as Slim Fast. However, I will say Slim Fast has a couple of options. I think Advanced Nutrition is actually a decent one that really does follow our guidelines for a protein shake. But typically, meal replacement is going to have more carbohydrate, fat. It's going to be fortified with vitamins and minerals, which can mess with the flavor a little bit there. It's made to mimic a meal. It's not necessarily really high in protein. Whereas the protein shakes and powders focus on protein, they're usually a little bit leaner, lower in calorie, and they can definitely help for those that are lacking protein in their diet. So with the protein powders, there are some suggestions in the guidebook. That's that yellow tinted, usually black spiral bound notebook you get from Dr. Karas's office. It's typically mixed with water or skim milk or some other lower fat or milk alternative. Watch the sugar that it's in the protein powder. It can get more than 10 grams, so just be careful there. They're typically better tolerated than the protein bars, so that's why we talk about the powders and the shakes more. And you can get creative with the powders. They can be added to other things beyond beverages. So when shopping, beyond looking at the sugar, you're going to want to look at what type of protein is used in it, or what is giving the protein to the powder. We typically recommend a whey or casein-based protein powder. This is utilized by the body really well. It's very popular, so it's easy to find. It's usually big, bold letters on the front, just like this example. It is derived from dairy sources, so if you're lactose intolerant, this is not the same as lactose. Whey and casein are the protein found in milk, whereas lactose is the sugar found in milk. So just realize that if you have a milk allergy or a milk protein allergy, then this will not work for you. You can look at some other options if you are nervous about the milk that's used, or the dairy derived source that is used in the whey and the casein. You can use egg, soy, hemp. They even make pea plant protein nowadays. So there's lots of options out there. Just whey and casein is considered a better quality for the most part. So beyond making it with just water and milk, you can make a smoothie with your protein powder. This is a very basic recipe. You can find lots of recipes online, and they make cookbooks or even specific bariatric cookbooks that are just on smoothies and beverages. So this is just a base recipe, usually equal parts liquid to frozen fruit. So in this case, we used fat-free milk. I like frozen fruit better because it gives it a better texture, keeps it more creamy and thicker. Mixed berries are the lowest in sugar, so those are sometimes a nice option. Make sure you add your protein in there. You can hide other types of protein as well. If you want to do Greek yogurt as a part of that protein source, you can add some other powdered, like peanut butter powder and things like that too, to give it flavor and also give it some more protein. About a tablespoon of chia seeds or flax seeds if you want to give it a different texture or hide some healthy fats in there. If you're looking to flavor your protein powder, if you're not already using if you're trying to go with maybe a chocolate flavored, you can use unsweetened cocoa powder. There are lots of recipes that use the sugar-free puddings as a way to flavor smoothies. You can also possibly use some of the sugar-free jellos or even the sugar-free Crystal Lights or things like that, Mio's, stirs that could give it a fruity flavor without impacting or adding a lot of sugar. And you can even hide your vegetables in here. So when you're limited on space after bariatric surgery, the more food groups you can get in, the better. So this is a way to nicely hide some veggies. If you're adding good fruit, or a good amount of fruit is what I should say, that will likely mask the taste of the spinach anyway. Adding protein powder to food items, that gets a little tricky. It can mess with the texture, so just be careful there. With a chocolate, vanilla, strawberry, or some sort of sweet protein powder, just think of sweet things that would be easy to hide it in, maybe a sugar-free pudding or a yogurt. With the pudding, we've had more patients, instead of adding the powder, they'll add a pre-made shake and use that to make it from scratch. If you buy a pre-packaged pudding from the store, it's not going to have nearly as much protein if you make it at home. Chicken soup flavored protein powder is really nice. You can put it in chicken or broth, or like a chicken soup or a broth. You can put it in mashed potatoes. You could probably hide it in casserole dishes or even make a dip from it. I've seen that before with a Greek yogurt, like a non-fat Greek yogurt. So this is very interesting. I think it's nice. Most people are like, that sounds really interesting or just different. It's nice because it is different. It won't be sweet. Most of the protein shakes and supplements are sweet, so this is a nice change of pace for a lot of people. And last but not least, they do make unflavored protein powders nowadays. The issue with these is that while they're not sweet or savory, they more so are not necessarily flavorless either. So add them to things with some flavor, maybe jello, blended soups, mashed potatoes, applesauce. If you add it to water, make sure you add some sort of water flavor. And once again, Crystal Light, Mio. You could even add it to a Gatorade or a Powerade Zero as is. Just add that unflavored protein powder in. What's nice about that is that you can even take that mixture and freeze it. And so you can make a high protein popsicle, especially if you're having surgery when it's warm outside. That'll be a nice treat. So these are just some popular brands. We have pictures of them. So they tend to come in these containers or bags that are generally pretty large. They're usually about 20 to 30 servings depending upon where you're getting it from. They do make bigger sizes. My caution to you is make sure you like it before you buy a massive amount of it, because everybody's different on the taste and textures of what they prefer when it comes to their protein powder. If you don't plan on using protein powders or you want another option, this is nice. You can use these shakes. So these are pre-made. You just buy them and you can drink them right away. I would recommend drinking them as cold as possible. That really does help with the texture and the flavor. If the brand that you know or were wanting to try is not on here, just try to keep it less or around 200 calories, at least 15 grams of protein and less than 10 grams of sugar. That's good in our book. Something else that's been newer to the market is protein water. These are more watery beverages, so they're not thick or creamy like the shakes are. These are going to be more water-based or thinner. They also are considered a clear liquid, which is really nice in the sense of after bariatric surgery, when you're on a clear liquid diet, you could bring one of these in if you are interested. So we have a couple of examples here. Premier Protein and Protein 2.0, they are on the right hand side. These are going to be pre-made. You can buy them off the shelf and you can drink them right away if you wanted to. The boxes are pictures of the powder, so you mix these with water on your own and you can make your protein water that way. Or like we mentioned, you can make your own protein water using water, a flavorant, and then an unflavored protein powder. The last type of protein supplement we have on here is the protein shot. This is our least favorite when it comes to the dietitians. We would prefer you to get it through the powders, the shakes, or the waters before having to resort to the protein shots. Reason being is that there's a lot of protein in a little bit of space. Your body needs time to absorb and digest and break down that protein and use it appropriately. Basically, once you start getting over 30 to 40 grams at a serving or at a time, your body is not able to use that to build muscle or tissue. It's then stored as fat if it is not burned for energy. So just keep that in mind when you see these. They have 64, 42 grams of protein in them. So you wouldn't want to drink it all at one time. You want to space it out if you are going to utilize these. Maybe drink half of it at once and then wait a couple hours and drink the other half. It also insinuates that we're going to be shooting this back. It's really hard to kind of take your time with it because there's such little volume. I'd rather you kind of sip on the protein shakes throughout the day than try to get one of these in. The taste is the way that I've had the taste described is very sour gummy worm-esque. It's very strong, potent to kind of mask a lot of that protein that's in there. But if you want to try them, you're more than welcome to. If you get really nauseated after surgery and are having issues keeping anything down, these might be nice because you won't have to do as much volume to get all of the protein that you need in. Return policies. So GNC is here in the mall here at Avita, or near Avita, Ontario, I should say. My apologies. And then Vitamin Shop's right across the street from us. These are just some return policies based off of these two establishments just due to their proximity to our program. You don't have to use these. You can use your local grocery store or even online shopping. If you decide to go to the grocery store, these are going to be found in the supplement section. So they're going to be found over by your vitamins, minerals, the health stuff, other things that you might buy over there, like the pharmacy area, I guess is what I'm trying to say. When I first went looking for them, I went to the workout area, I went to the grocery aisles and could not find them. They are going to be over there by the pharmacy. If you plan on going with a powder, which I think is a great option, you can have a lot of flexibility with it. You're going to want to possibly look into a shaker cup, such as a blender bottle that comes with that whisk. That whisk is used to shake it up, and when that whisk gets in there and is moving around, it will agitate the protein and keep it from making lumps or clumps of it. Blender bottle's a name brand. You can find an off-brand shaker cup. When it comes to blenders, once again here, Nutribullet name brand, you can find an off-brand. I bought mine at Walmart 2 years ago now for like $15 and it still works just great. When it comes to the blenders, they're nice. You can puree foods in them for when you're on that pureed phase, but you can also make your smoothies in them and kind of give you a different taste and texture than just mixing it with water or milk would for that protein powder. If you're interested in trying protein powders without having to commit to the big containers of it, Nectar is one brand that lets you get sample packs or little, one serving containers of them prior to purchasing a large container. This is not a free program. There is a cost associated with it, but if you're interested, check out the links. They will take you to those websites that allow you to try some of these sample flavors. Alrighty. So that's everything for the class 2 today. There will be a quiz posted that we will want you to be filling out that will allow us to make sure that you participated in today's class, and that will trigger us to then give you a call and check in with you and make sure that you don't have any questions, make sure that we can go over the quiz together and make sure that there's no issues or concerns or things maybe that we didn't cover very well within our recorded presentation. So we would really appreciate your feedback. That would be a nice opportunity as well to do that. Our contact information will be listed there. If you've got questions, you can contact the Bariatric Clinic or you can contact the Nutrition Clinic as well over here at Avita, Ontario. We really appreciate your support at this time, and hopefully this audio recorded video works well for you. Have a great day. We'll see you around.